From the WDXY studios in historic downtown Sumter, At Your Service Home Care presents Medical Forum with moderator Jeff Reed.
And welcome to Medical Forum. I'm your host, Jeff Reed, with my co-host, Chris Marr. Chris, how are we doing today?
Doing well, Jeff. How are you doing this weekend?
Well, doing very good. I thought what we might start the show, and of course we talk about medical topics, but I think a good review of last week. That was kind of a fun show with Colonial Aesthetics with Nancy Hunter.
It was a great show, Jeff.
Yeah,
we really
a lot
got
of
to talk
responses.
about a lot of different things, things that, when you hear about aesthetics, you think about just kind of women having certain procedures done, but we really talked about men and women benefiting from these different procedures.
Yeah.
We really got into a little bit of a tangent about skincare with using SPF sunscreen.
Which you pretty much said it didn't matter.
Yeah.
As long as you have zinc in it, and there was one other ingredient, I can't remember it. But anyway, then we talked about cool sculpting too, which I think is a great procedure that she has exclusivity, it sounds like, in Sumter.
Yeah, absolutely. I think you have to go quite a ways outside of Sumter to get cool sculpting.
Yeah.
Either in Columbia or Charleston. And I know I talked to Nancy Hunter a couple of days ago, and she had a little bit of
she wrote you a prescription for it, didn't she?
Yeah, she told me to come in and get a procedure done, but she's had a little bit of an increase in call volume in the last couple of days.
That's great
for cool sculpting. So
well, and she's super. So I'm sure you're proud of that, being a part of Colonial. And first of all, let's also talk and thank our sponsor, At Your Service Home Care, your concierge, your steward, your guide to home care and beyond. Located on 1250 Wilson Hall Road. You can reach them at 803-607-9677. They've been a great sponsor for us. And I think something that I like about them also on their website, which we'll give a plug for, www.ays/homecare.com, all of our shows appear on the website. So as we talk about Nancy Hunter and Colonial Family Practice and all the previous 8 to 9 shows that we've done, they're all there. So you can review.
All you have to do is click on radio show, and they are all recorded right there. You can listen to them over again if you like.
And I think that's great. And today's topic is interesting. I think a lot of people have seen two buildings being erected in this town. One of them was near and dear to me. It's where Reliable Medical Equipment was for 5 years. And then across from the YMCA, there's a new building coming up, and they both have to do with dialysis. So our guest later on in our next segments, Tina Silvester, will talk about dialysis from a social work standpoint and what really causes it as far as how they can help a dialysis patient. But, having you here as a physician, let's talk about that. So we're talking about, what's the technical, kidney?
Yeah, we're going to be talking about chronic kidney disease.
Chronic kidney disease.
And it's this is a disease that affects so many Americans, and it's very apparent by the number of dialysis centers that are being erected right now.
Yeah.
Just like you said.
Yeah.
There are several in town.
Well, in Sumter, apparently. We got two of them coming up, and there was already one established. So somebody's done some research, so we thought this would be a great time to talk about it. With you being a physician and seeing it with your patients, let's educate people on what exactly chronic kidney disease is. Dr. Marr.
Well, your kidneys are the filters of the body. They are responsible for filtering waste in the body. They are responsible for regulating blood pressure. They're responsible for regulating the sodium, potassium, and other electrolytes in the body. And they're responsible for controlling the amount of water in the body. So the kidneys play an extremely important role in our day-to-day functions. So chronic kidney disease is any condition that damages the kidneys and decreases their ability to keep you healthy, basically. Wastes build up in high levels in the blood and make you feel sick because there's no other way to excrete them.
What are some causes? So if I'm what have you found that people that have chronic kidney disease, what causes this?
Well, I'm going to go into some real fine details about the causes in a minute, but just generally speaking, 2/3 of all cases are caused by diabetes and hypertension.
Wow.
And we all know how frequent those two problems are.
especially here in Sumter.
Diabetes and absolutely, just throughout the entire country, diabetes and hypertension are such a problem.
Well, let's touch on what are some of the facts. I mean, so when a lot of times in medical, there's some speculation. There's some, what causes this? What are facts that people would say? You know what? These are facts. This is what causes.
Let's go through.
Let's take hypertension. I have a
great list of a little bit of research I did, and I'm going to give some kudos to the National Kidney Foundation. A great website, and I pull a lot of facts off of there. 26 million American adults have chronic kidney disease, and obviously millions of others are at risk. The problem with chronic kidney disease is that even though there are some symptoms that we'll talk about in a minute that may tip you off that you're starting to have problems, kidney disease is silent. It's creeping up. It's causing problems without the patient even knowing it.
So I can go from feeling good to all of a sudden
to a slow decline.
Like pain.
A slow decline.
Pain may be something that spurns this on.
And unfortunately, though, when you start to have symptoms, it's usually in the later stages. So you've really already got a significant amount of decline by the time you're starting to feel anything. And that's why as physicians, there's so many different tests, predominantly urine tests, that we'll do to try to detect things long before it's ever a problem. Generally speaking, most of my patients who develop kidney disease, meaning they need a treatment for kidney disease, they've known they've had kidney disease for years because we're screening early. We're checking the urines for protein. We're checking the kidney function through the blood. And we're doing those on a regular basis in the management of diabetes, for instance. Most of my diabetic patients, we try to get them every 3 to 4 months for blood work. And patients often say, gosh, every 3 months, it's so taxing. But things change. And it's through that blood work, through those urine tests, that we can pick up on disease states early and oftentimes change regimens to stave off the disease, to prolong progression of these problems. But kidney disease is really
Is heredity a key? Well, does it play a factor?
There's certainly components that I think will predispose you to kidney disease. I think it's very important to realize that different ethnicities have greater incidence of kidney disease. And I'm going to talk a little bit about that as well in a few moments. But there's definitely certain ethnicities that are predisposed to kidney disease.
Gotcha. So as we come up, and we probably have about 15 seconds left in our first break, as we learn about this, and again, it's chronic kidney disease, and we mentioned earlier Sumter has just erected 2 major facilities to control this. So I think people listening in are going to be able to relate to this. So as we come up on our first break, again, thank you to At Your Service Home Care, 1250 Wilson Hall Road. Dr. Marr will be back, and we'll continue to learn about the symptoms, the facts, how do we cure this, and we'll be back after this message.
Back with the latest in health and medical news on Medical Forum, presented by At Your Service Home Care, WDXY 1240 AM and 105.9 FM.
For some, in-home assistance is temporary while recovering from surgery, injury, or welcoming a new family arrival. For others, however, it's the beginning of a new path. It's often an overwhelming path of confusion, gaps in service, and questions when a family finds out Medicare doesn't pay for extended nursing home, assisted living, or in-home care. At Your Service Home Care is owned by Sumter Physicians and medical equipment providers. They have combined their expertise in healthcare and medical equipment together with specialists in the fields of in-home care, home health and hospice support, insurance, and attorneys. This team stands as the link between what a family needs needs and how to find resources to make it happen. At Your Service Home Care has the knowledge to provide in-home care and beyond. But it's much more than a sitting service. It's the one call for a family to have concierge service, steward, and guide to create and implement a game plan for the care of a loved one right now and for the days ahead. To discover your path to the finest in home health care, call At Your Service today at 803-607-9677 or visit them at 1250 Wilson Hall Road today. Find them online at www.ays-homecare.com.
Owning a firearm is both a right and responsibility, and keeping your firearms out of the hands of criminals is a special concern. Last year, 38 guns were stolen from cars and homes in the city of Sumner. This is Joey Duggan reminding you to do your part as responsible gun owners. Help keep firearms out of the hands of criminals. Locking your vehicles in storage compartments if leaving a gun in your car, never leaving firearms in your vehicle overnight, and storing all firearms securely in your home. For additional information on firearm safety, contact the Sumner Police Department's Crime Prevention Unit at 436-2723.
As a referee, I pay attention for a living.
While I'm busy watching the game, I need your help keeping an eye on the stands.
If you see something that doesn't look quite right, tell a law enforcement official.
We all play an important role in protecting our communities, and you can help.
If you see something suspicious, say something to local authorities.
If you see something, say something is used with permission by the New York Metropolitan Transportation Authority.
This is Medical Forum, presented by At Your Service Home Care.
And we are back with Dr. Marr, and we were talking about chronic kidney disease when we first left. Also want to remind all the listeners of course, here on Saturday morning from 10 to 11, Medical Forum, sponsored by At Your Service Home Care. But we also replay the show on Sunday from 2 to 3. So, Dr. Marr, let's go back. We left off. We were talking about chronic kidney disease.
Yeah, Jeff, again, just so prominent, such a prevalent disease in the United States. Again, 26 million Americans have chronic kidney disease. And we were talking a little about early detection can help prevent the prognosis of the kidney disease, prevent the progression of kidney disease, to end-stage kidney failure, which is dialysis. And we're going to talk a little bit more about that in a minute. But again, important to get screened early.
And let's talk real quick, if I can. Screening consists of a urine test predominantly?
Predominantly, urine test. It's called a microalbumin creatinine ratio, and it's actually a spot test. It's a test that can be done in the doctor's office, and they run the test within a few minutes, and it can tell you normal. It can tell you if there's a small amount of protein or a large amount of protein in the urine. And really what we're talking about is protein in the urine. And the reason that's so important is the kidneys, again, are a filter. They filter out all sorts of things. And protein is a large molecule and should not be filtered into the urine.
Hard to get it out.
Right? Exactly. Yeah. So you kind of think about it as if the protein's getting through, it means that filter's getting a little bit leaky.
So just using like a colander, for anyone who's in the kitchen who has a colander, and we drain off all the fluid, which would be, in this example, the urine, but sticking in there would be the protein, and unfortunately then it's not being discarded.
Exactly.
Is that a good example?
If the larger molecules are getting through that filter or that colander, that means that it's starting to wear. And that's a great example. It's a great example of how that colander. Kidney disease is linked to a lot of other things. It's not a standalone problem. Again, we talked about some of the causes. We're going to talk about more in a minute, but heart disease is a major cause of death for all people with chronic kidney disease because the kidneys affect the entire body. And so if you have kidney disease, the heart can be affected as well. Hypertension causes kidney disease, but kidney disease also causes hypertension. So you have a little bit of a snowball effect.
Right.
Again, kidney disease is a protein problem. It's leaking of the kidney, causing proteinuria or protein in the urine. High-risk groups include those who have diabetes, who have hypertension, who have a family history, like you talked about, Jeff. And those are the patients, those are the people that need to be getting screened, seeing their doctor.
Mentioning diabetes a little bit, does diet have anything to do with that, or is it like we've talked about, diet may cause diabetes, which in turn diabetes, so it's a trickle down?
Absolutely. And hypertension. Hypertension is a very common cause of chronic kidney disease. And so diet that causes hypertension is going to lead to absolute
fried
sodium.
Chicken. Are you telling us we can't have fried chicken anymore in the South? This is the end of the show. Everyone, thank you for coming. Well, I mean, here in the South, maybe that's why. I mean, we have so many...
high sodium diet. A lot of fried foods. Salt shaker is used very heavily in the South. And I think there's a lot of factors like that can...
So heredity's there, but can we control this? So if I come into your office and we do the urine test, and Jeff, we have some high protein and hypertension. What do I need to do if I say, man, this is serious? Because we'll talk later about dialysis with the dialysis centers here, and that is not a fun trip. And
that's a result that no one wants to end up.
No. So how do I avoid this?
So with the kidney disease, again, the scenario you gave, you go in and you have a little bit of protein in your urine. So the goal is to modify the risk factors, aggressive risk factor reduction. So first of all, hypertension, control the blood pressure. What are the things that control the blood pressure and give us a normal blood pressure? Exercise, maintaining a normal body weight, low sodium diet. And if you look at the studies, some people are salt sensitive and some people aren't salt sensitive. So the studies show that some people can eat a lot of salt and it not affect them, but others can have a very small amount of salt and it raises their blood pressure dramatically. We just don't know who is who. So again, generally speaking, a low sodium diet is important. We have to also remember that processed foods are high in sodium. Sodas can be high in sodium. So even though we're not using the salt shaker, those other sources of sodium can come into play. Keeping the blood pressure controlled. If you have high blood pressure, take your medications.
Right.
Taking your medication every other day does not help you. If you are prescribed a medication to use daily, you need to take it daily. If you're prescribed a medication that you take twice a day, you need to take it twice a day. Because those medications wear off and then your blood pressure elevates.
So when people think about high blood pressure, they think, I got a headache, or the symptoms that are correlating to high blood pressure. There's an inside effect that you talked about in the first segment. It's kind of a silent effect. We don't know that we have, chronic kidney disease until it's maybe too late.
Well, absolutely, because hypertension has always been denoted as the silent killer. You typically do not feel the effects of elevated blood pressure.
Yeah.
Generally speaking. So again, if you're on that medication, you need to be taking it. You need to be compliant, and you need to be following up with your doctor regularly.
You think about every 3 months, probably.
I said 3 months with diabetes.
Yeah,
hypertension, maybe not necessarily. Patients who are taking their blood pressure medication regularly and doing well, they may not need that 3 months. But really, these are discussions to have with your physician, and so that it's constantly being reassessed, making sure that those are not happening.
Does age play a part in this? As we come up kind of on our end of our second segment, and we'll have Tina Silvester here to talk to us about dialysis when we don't do all the things that you've mentioned. But is age something that you see, a predominant age where this happens?
Well, unfortunately, we see chronic kidney disease in all ages, and there are even some causes of kidney disease that can occur in children.
Wow.
So, but having said that, as we age, things tend to wear out. So the blood vessels in the kidneys are wearing out and they're causing the damage. So age certainly has a component or plays a factor into it.
But it's usually a pretty long-term, not a long-term effect in the fact that we gradually keep breaking down these kidneys through hypertension, through our diet. As we get older, it's a lot tougher to stay thinner. So as we come up on our second break, Dr. Marr, we'll be introducing Tina Silvester, who will talk to us from a social work standpoint about dialysis and what that's like. How do we get on it? How do we get off it? And we'll be right back after this month.
We'll be back with Medical Forum, presented by At Your Service Home Care on Sumter's home for news, talk, and sports. WDXY 1240 AM and 105.9 FM.
Reliable Medical Equipment, locally owned and operated since 1999, provides a full range of medical equipment and services. Our accredited facility is fully staffed with the certified personnel for all your diabetic shoe, custom orthotic bracing, and prosthetic needs. Conveniently located at 246 Broad Street, right across from Firestone and just down from Colonial Family Practice. We accept Medicare, Medicaid, TRICARE, and most private insurance. Stop by today or give a call at 934-9212. That's 934-9212 in Sumter or 435-9927, 435-9927 at our Manning location at 37 West Rigby Street. See why Reliable Medical Equipment has been voted best facility for prosthetic and orthotic for 7 years straight. Reliable Medical Equipment. For some, in-home assistance is temporary while recovering from surgery, injury, or welcoming a new family arrival. For others, however, it's the beginning of a new path. It's often an overwhelming path of confusion, gaps in service, and questions when a family finds out Medicare doesn't pay for extended nursing home, assisted living, or in-home care. At Your Service Home Care is owned by Sumter Physicians and medical equipment providers. They have combined their expertise in healthcare and medical equipment together with specialists in the fields of in-home care, home health and hospice support, insurance, and attorneys. This team stands as the link between what a family needs and how to find resources to make it happen. At Your Service Home Care has the knowledge to provide in-home care and beyond. But it's much more than a sitting service. It's the one call for a family to have concierge service, steward, and guide to create and implement a game plan for the care of a loved one right now and for the days ahead. To discover your path to the finest in-home health care, call At Your Service today at 803-607-9677 or visit them at 1250 Wilson Hall Road today. Find them online at www.ays-homecare.com.
This is Medical Forum, presented by At Your Service Home Care.
And we are back for our third segment of Medical Forum, and today, chronic kidney disease. Dr. Marr, you have brought us in on all the symptoms, how do we prevent it, what kind of tests we do, and we're going to finish with that, and then we'll bring in our guest today, Tina Silvester, to talk to us about dialysis. So give us kind of a closing comment, a summarization of what we've done in the first two segments for those that are maybe just joining us.
Well, we've talked thus far about what chronic kidney disease is. We talked about some facts about how prevalent it is in our society, talked about some risk factors. What we haven't touched upon is really what causes. We started to talk about hypertension, the major causes of chronic kidney disease. There's a couple of ethnicities that are much higher risk for chronic kidney disease: African Americans, Hispanics, Pacific Islanders, American Indians, and then, like you had said, anyone at increased age is at a higher risk for chronic kidney disease. Going back a little bit, just to reiterate, the two major causes, 2/3 of cases for chronic kidney disease, are diabetes and hypertension. We talked a little bit in the last segment about hypertension and how important it is to control it. We talked a little bit also about diabetes, and that, again, tight control of diabetes, and that includes blood sugars, that includes cholesterol management, includes healthy lifestyle, maintaining a lean body mass, control of the blood pressure, low sodium diet. Again, there are a couple of other causes. Chronic infections, urinary tract infections, as benign as those seem, if they occur recurrently or if they become a infection of the kidney, that can cause kidney disease. Again, some children can be born with malformations. Polycystic kidney disease, for instance, can cause chronic kidney disease, can cause damage of the kidney, and can cause a child to have to suffer with this type of disease.
So now, which brings us into our guest today, Ms. Tina Silvester, Tina, how are we doing today?
Doing good. Thanks.
All right, very good. And Chris has kind of brought us up to speed, as you know, on what the symptoms are from a doctor's perspective. If we could, let's take Miss Tina. Give us a little background on yourself. Who do you work for? Give a little plug. How do we reach you? And then we'll dive into dialysis.
Okay, so my name is Tina Silvester, and by education, am a social worker. Have experience at Toomey Healthcare Systems as a social worker doing discharge planning with kidney disease patients mostly. And in doing that over those 10 years, saw a big need for education. Patients were ending up in the hospital in an emergency situation, needing dialysis and not really knowing how they got there.
Right.
I had an opportunity to go to work for Fresenius Medical Care here in Sumter as a treatment options specialist. And basically what that means is I do pre-end-stage renal disease education and talk to patients about what kidney disease is, what happens when their kidneys fail, and what can be done once that happens. So we go through the education as far as the dialysis treatment options pre-ESRD, pre-end-stage renal.
And while we're at it, what locations do you service in your company services?
So my service area is Sumter, Lee County, Lake Marion, Dialysis, Manning, and I also cover Orangeburg, Bamberg, and Holly Hill area. But Fresenius is all over the United States. They service very many areas.
And your location here in town, we talked about briefly 2 of them popping up here. Mm-hmm. So we thought that this would be a great topic for our show, Medical Forum, to talk about chronic kidney disease. Your location?
So we have the Fresenius Dialysis Center on 615 West Westmark.
Okay.
My home department is at 653 West Westmark. And we have a new dialysis center, and I actually don't know the address to the new center.
It's over by the Y, is that correct? All right,
right.
Well, everyone knows what the YMCA is. Surely they do. Well, we've been talking about how we try to prevent being a patient of that dialysis. Talk us through. We have failed now. We have not seen our doctor. We have hypertension. We're not taking our meds. We're eating our chicken, which Chris and I said we were going to do. I mean, that's just life, isn't it?
Yeah,
regardless.
that's just life in the South.
So we just have decided this is what we're going to do. Dr. Marr has diagnosed me and said, we've got to see dialysis. Where do you start in that process? What is the company that you represent? What happens from this point?
Well,
Talk us through.
The earlier that I get involved, the better, because the earlier a patient gets education, hopefully they're less likely to need dialysis, understanding the need to take their medicines, get their labs checked, that sort of thing. So I actually start doing the education at a stage 3. Once a patient is diagnosed, they've been to their primary care doctor, their lab works indicate some kidney disease, and I can start talking with those patients then. Ideally, we talk to patients at their stage 4, where they have less than 30% kidney function, and we start encouraging access placement so that when and if they need dialysis, they go in as the optimal patient. They have a good access. There's no need for catheter use. So we start talking really good with patients at stage 4 about the need for early access placement because those can't be used for a good 6 months after they're placed.
Gotcha. And as we talk about stage 3 and 4, I assume is 4 our last stage? Is that
5.
end renal? So that's end renal stage. Okay.
Stage 5, when you're GFR.
What does that mean for us dummies out there?
So a GFR is a glomerular filtration rate, and that is an estimation of how well the kidneys are continuing to filter.
Okay.
And use an equation derived from blood testing.
Okay. So going back, stage 3, symptoms, guys. What kind of symptoms do I have?
So
Any?
I'm gonna go out as a non-doctor and say that there truly are no symptoms to kidney disease. Yeah. There really aren't until you are at stage 5 and you need dialysis. The symptoms aren't really there. Now, you may have symptoms from high blood pressure being uncontrolled. You may have symptoms from your diabetes being uncontrolled.
Right.
But kidney disease symptoms, truly, you don't see until the need for dialysis.
Scary, because it's hidden.
And that's why it's very important for the follow-up and the lab work.
Okay, so Dr. Marr has done his test, and as we mentioned, we just have not followed his tremendous orders that he gives. And I am stage 5.
Okay.
I am end renal failure. dialysis. A lot of people hear about that, but they have no idea. And we have about a minute left in this break. So if you can kind of start us on that, and then we're going to follow up. But a lot of people hear the word dialysis. They know they don't want it, but they have no idea what we're talking about. Now, as in the medical community, we do. So, Tina, give us kind of a 30-second to a minute short version of what dialysis is, and then we'll reel it at a large level in our fourth segment.
Okay. So what is dialysis? Dialysis is a life-sustaining process that cleans waste products from the blood and removes extra fluid when a person's kidneys fail. Dialysis patients typically require treatments on an ongoing basis unless they receive a kidney transplant.
Okay. Well, you know what? It doesn't get any better than that. That might even be the short but accurate version. So dialysis, we're waiting on a kidney transplant. And we'll talk about, can it be reversed? Is there home dialysis? Do we have to come in? How often is this? As we come up here on our third break again, we'll thank our sponsors at your home service home care, located on Wilson Hall Road, 803-607-9677.
Back with more
right
on Medical Forum, presented by At Your Service Home Care.
For some, in-home assistance is temporary while recovering from surgery, injury, or welcoming a new family arrival. For others, however, it's the beginning of a new path. It's often an overwhelming path of confusion, gaps in service, and questions when a family finds out Medicare doesn't pay for extended nursing home, assisted living, or in-home care. At Your Service Home Care is owned by Sumter Physicians and medical equipment providers. They have combined their expertise in healthcare and medical equipment together with specialists in the fields of in-home care, home health and hospice support, insurance, and attorneys. This team stands as the link between what a family needs and how to find resources to make it happen. At Your Service Home Care has the knowledge to provide in-home care and beyond. But it's much more than a sitting service. It's the one call for a family to have concierge service, steward, and guide to create and implement a game plan for the care of a loved one right now and for the days ahead. To discover your path to the finest in home health care, call At Your Service today at 803-607-9677 or visit them at 1250 Wilson Hall Road today. Find them online at www.ays-homecare.com.
I was visiting my elderly aunt and her phone rang.
Oh, it's you again? But I already have life insurance.
The caller was doing a great job keeping my aunt on the line.
My credit card number? Hold on.
Well, when I picked up the phone and said hello, the caller hung up.
McGruff the Crime Dog here. Recognizing fraud can be difficult for older people. The National Crime Prevention Council wants you to know how to spot a scam and report it to local law enforcement agencies.
Learn more at ncpc.org/seniors. A message from the National Crime Prevention Council and the U.S. Department of Justice.
Are you always looking for places to stop and rest because you're short of breath, wheezing, or coughing? Who wants to live like that? See your doctor for a simple breathing test to find out if it's COPD, a serious lung disease. With treatment, soon you could be living more and stopping less. Visit copd.nhlbi.nih.gov. A message from the U.S. Department of Health and Human Services.
Now back to Medical Forum, presented by At Your Service Home Care on WDXY, 1240 AM and 105.9 FM.
And we are back. We're going to start our fourth segment. We have our guest, Tina Silvester. Dr. Marr is with me as well. I'm your host, Jeff Reed, Medical Forum, sponsored by At Your Service Home Care. Again, thank you for visiting it with us on a Saturday morning. If you don't catch all the show or some of the show, please check us out on the replay on Sunday from 2 to 3. So, Tina, back, we talked about dialysis. We've talked about coming in as end renal failure, which I believe stage 5, and it is in lieu of, or in hopes, I guess, of getting a kidney transplant. And it's a life-sustaining process. So we can't decide to, I think I'll just miss my appointment. What happens?
So first of all, kidney transplant, that is considered a treatment option. It's not it's not a, what am I trying to say?
Well,
it doesn't fix the problem. It's not a. I mean, it is a treatment option, just like dialysis is. It doesn't heal you. That's my word.
Okay.
It doesn't heal you. It is a treatment option for dialysis. Not everybody is appropriate for a kidney transplant. You can go on the list for a kidney when your GFR hits less than 20. So you have the potential to actually get a kidney and never need dialysis, but it doesn't happen often that way because that is quite a process.
Well, I know that some people, it's a 3-day-a-week process. Every other day, you have to go in to have this, and maybe take us through the process. Okay. Maybe let's start with that.
So dialysis can be done in a center 3 days a week for 4 hours of treatment. It also can be done at home where you have the same type of 3 days a week, 4 hours treatment at home, and it can be done shorter daily dialysis. So people go on home hemodialysis and they do it every day for less time. And it's more individualized to a patient's treatment prescription.
Why would somebody not do that? I would love to have it shorter and get to stay home. Is it a prescription? Is it a insurance-based situation?
Insurance covers all dialysis the same. Home hemo requires a partner, so some patients don't have that support system at home.
Okay.
You have to have somebody learn with you. You cannot do home hemo at home without somebody being with you. But there is peritoneal dialysis, which is a home therapy that can be done by yourself. You don't have to have a support person at home, and we can teach you how to do that as well.
Okay. Very good. Very good. Dr. Barr, how many patients do you see that you have to break this news to them? It's time. Unfortunately, obviously the signs, we don't have the visual signs, but you have the medical signs from the testing that hey, your hypertension, hey, you're 50 pounds overweight, hey, your sodium levels are out the roof. What's it like when you have to talk to this patient to say, here's what is going to happen from this point on now?
Well, I see patients on a regular basis with chronic renal disease. Most of the patients who are receiving hemodialysis are being followed by a nephrologist or a kidney specialist. But again, it's managing the chronic kidney disease. I'm typically managing patients in their early stages of disease and, again, trying to modify risk factors to prolong their kidney disease, to prolong their time off of dialysis. But we do have to make that decision every once in a while and get a patient set up for dialysis and get them over to a nephrologist for kidney hemodialysis. But again, the most important thing I have to say is modifying the risk factors. And chronic kidney disease can be the course of this disease can be modified.
Well, let me ask you this as a primary physician, is this something for me, and either one of you can answer this, I have to get a referral? I have to go see, you mentioned a nephrologist. Maybe let's talk about, Tina, what is a nephrologist?
Nephrologist is a physician that specializes in kidney. So, your primary care doctors treat the hypertension, diabetes, all of the primary care symptoms, disease processes that patients have. And at some point, when a patient's kidney function gets decreased, most primary care physicians are going to refer to a kidney doctor to maintain those symptoms and continue to treat the kidney functions.
I'm with you. So what are some of my options now? When I hit that stage 5 renal, and you've mentioned some of, and maybe in a little more detail, we talked about that I could get dialysis at home.
So,
and go ahead, please.
So when I sit down and talk with a patient, bottom line is they're faced with, oh my gosh, I have to be on dialysis.
Right.
And that is a very hard thing to take in and process. And on top of that, we're coming at them that you got to have surgery to get an access placed. And, and they hear all of this, and it's just a complete fear. And so what my job is to get them to the place where they understand that although, your kidneys aren't working for you anymore, dialysis is life-sustaining. You can continue to live the life that you choose to live and remain on dialysis treatments. You can continue to work. There are things that we go through with just, it's the whole process.
So social work, you're really a coach here.
Absolutely.
You are coaching them up, and because I know some people, I've known people that, in the medical, at Reliable Medical, who are faced with this, who have in their will, and I'm not going to do it.
Yeah,
and choose not to go through this.
We have patients, and that is a treatment option as well. You can choose no treatment, but my role is to explain all of those different types of dialysis and how it can best fit your life to continue to live the life that they want to live. If they travel, that's okay. Let's talk about how you can travel. So we go through the different dialysis treatment options, and there are two types of dialysis. One is peritoneal dialysis and one is hemodialysis.
Can you differentiate for us, please?
So hemodialysis is the process of hemo blood that most people know about. Hemodialysis in a center 3 days a week, just like you said. Dialysis is 3 days a week in a center for 4 hours, and that is right. But that's not the only way you have to do dialysis. Hemodialysis uses an artificial kidney or a dialyzer, a hemodialysis machine. You have a special blood access that's created in your arm by a surgeon, which we like to get placed early so that we can use it when it's time to be on dialysis. And at the start of each treatment, they put 2 dialysis needles into your access. One of those needles will take your blood away from the body, and one brings the blood back in after it's been through the dialyzer. The treatment time, during that time, the blood's taken from your access through the tubing, through the dialyzer, and it filters your blood, and it removes the waste products and the extra fluid, and then it's put back. The clean blood is put back into your body, and that's what the process of hemodialysis is. There's very little blood out of your body at any given time because we know we can't live without the blood, and that's why it takes a little bit of time to do dialysis. That's why it's a 4-hour process. You can do dialysis via hemodialysis in a center, which is what most people know, and you can also do hemodialysis at home.
Well, as we come up on a break, we'll talk about the other ways that we can do dialysis, and I think also you can sit in a chair, you can lay down. So it's something that you make them very comfortable as they go through this process. So as we come up on our fourth and final break, we'll be right back with Tina Silvester talking about dialysis and Dr. Chris Marr.
Back with the latest in health and medical news on Medical Forum, presented by At Your Service Home Care, WDXY 1240 AM and 105.9 FM.
Reliable Medical Equipment, locally owned and operated since 1999, provides a full range of medical equipment and services. Our accredited facility is fully staffed with the certified personnel for all your diabetic shoe, custom orthotic bracing, and prosthetic needs. Conveniently located at 246 Broad Street, right across from Firestone and just down from Colonial Family Practice. We accept Medicare, Medicaid, TRICARE, and most private insurance. Stop by today or give a call at 934-9212. That's 934-9212 in Sumter or 435-9927, 435-9927 at our Manning location at 37 West Rigby Street. See why Reliable Medical Equipment has been voted best facility for prosthetic and orthotic for 7 years straight. Reliable Medical Equipment.
I was visiting my elderly aunt and her phone rang.
Oh, it's you again? But I already have life insurance.
The caller was doing a great job keeping my aunt on the line.
My credit card number? Hold on.
Well, when I picked up the phone and said hello, the caller hung up.
McGruff the Crime Dog here. Recognizing fraud can be difficult for older people. The National Crime Prevention Council wants you to know how to spot a scam and report it to local law enforcement agencies.
Learn more at ncpc.org/seniors. A message from the National Crime Prevention Council and the U.S. Department of Justice.
Are you always looking for places to stop and rest because you're short of breath, wheezing, or coughing? Who wants to live like that? See your doctor for a simple breathing test to find out if it's COPD, a serious lung disease. With treatment, soon you could be living more and stopping less. Visit copd.nhlbi.nih.gov. A message from the U.S. Department of Health and Human Services.
This is Medical Forum, presented by At Your Service Home Care.
And we are back with our special guest today, Tina Silvester, with Fresenius, dialysis social worker, Tina. And when we left, you're talking about the different ways that we can do dialysis. And hemodialysis, would you say that's the most popular way that people do?
That is what most people know.
Okay.
Hemodialysis.
Okay.
So we just talked about the fact that you could do hemodialysis in the center, but it also can be done in your home. A partner is necessary if you want to do home hemodialysis. The machine and supplies will be sent to you. A clinic nurse in our home department at Sumter Home would start the training process with you and your partner. It takes about 4 to 6 weeks of training where you learn to actually perform the treatment and troubleshoot. Once you're on your own, support services are available by phone during your treatment, but it's just like driving a car. Once you learn how to do it, you got it. And
right.
It's the fear of learning is kind of what holds people back. But, the supplies are sent to your home. The insurance covers everything just like it would doing therapy at the center. With home hemodialysis, you can travel. Wherever you go, we send your supplies there. You meet the supplies when you get there, and you can do the therapy at the beach or in the mountains or wherever.
She could be gone for 2 weeks, and we just send the supply to the location. Wow, that's
and
cool.
Very quickly within center, you can still travel. Life doesn't have to stop because you do dialysis in the center. You just have to go through your social worker in the clinic to arrange a transient clinic wherever you go, so that they'll have a clinic waiting on you when you get there.
No, would you do that, or
they have?
You're the trainer.
That's right. I'm doing education with treatment options.
Right.
They actually have social workers in the dialysis center that do that.
Very good.
So. With home hemodialysis, your treatment times are more flexible. You don't have to travel to the dialysis center. You feel more independent. It's just a great form of dialysis. And with home hemodialysis, it's also more focused on your individual labs. So not everybody's on the same schedule like they are at in center, or the same prescription like they are in center. But there's also another way to do home therapy, and I know I need to get that in before we're done.
Hey, talk about that.
So home therapy can also be done through peritoneal dialysis. It is a type of dialysis that is not actually, there's no blood involved. There's no needles involved. The peritoneal dialysis works by using your own peritoneal membrane as a filter for your blood. We all have a space in our abdomen that's a very thin lining called the peritoneal membrane, and a catheter is actually put in through that peritoneal membrane and extends outside of your body. We have a special solution called dialysate that's put in through that cavity through the catheter. It remains in the cavity for several hours, and while that fluid is there, it's removing the excess water and waste products from your blood into that membrane, and then we drain that fluid out. It is a very
This sounds great, by the way. Why would I not want this one?
So there's a lot of negative in the community rumors or things that you hear about people getting infections.
Okay.
You have a catheter outside of your belly, so it is an open avenue to the inside, which is why probably 80% of our training has to do with infection control.
Okay.
There are lots of things that you have to learn, but it only takes 7 to 10 days to teach you how to do peritoneal dialysis at home. Like with hemodialysis, it takes 4 to 6 weeks. It's only 7 to 10 days with peritoneal dialysis. It is a very easy way to do dialysis, very non-invasive, and it can be done through a machine called a cycler at night while you sleep. So you connect to this cycler, you go to sleep, the machine cycles the fluid in and out while you're sleeping. When you wake up in the morning, you disconnect, and your dialysis is done for the day.
Well, I know people have side effects with dialysis. I've heard numerous patients of ours at Reliable that'll come in, they're like, I have dialysis on Monday, Wednesday, Friday, and the negative is I just feel so worn out on Tuesday. Is that's an accurate with all of these, or do you find that that's...
So you hear some of that, and some of that you hear the terms pulling too hard, or with peritoneal dialysis, it's actually non-invasive. It's very light. It happens over a longer period of time, so it's not as hard on your system, and you're doing it every day. So it's a more gentler form of dialysis that happens over a longer period of time, and it's done daily, so you don't have as many feelings of tired. Mm-hmm. Every evening when you get ready to go to sleep, you're hooking up to this machine, and it's running through the night.
Wow.
It is a self-care treatment. You're in control of your treatment times. They have to be done every day, but they're gentle. Most people have no discomfort at all.
How long does it take to cycle through that one? We talked about 4 hours when you go to the facility.
Generally 8 hours. Generally, you're with peritoneal dialysis, you hook up when you go to bed and you run about 8 hours. Now, I know not everybody sleeps 8 hours, but Most
I
of
wish
us
I could, though.
lay around. We can watch TV laying in the bed, whatever. And it takes about an 8-hour treatment.
Do we feel it? Can we still sleep? Is it comfortable, or is it kind of like
the machines are quiet? Most people are able to rest peacefully. And with peritoneal dialysis, which is always a huge plus, the diet's more flexible, so you don't have quite those restrictions on you that you do on hemodialysis. But with peritoneal dialysis, it's an easy form of dialysis to travel with.
Is that a newer dialysis? Is that a more
it's
latest? Is that the older one? Okay.
Been around forever.
Okay. Let's talk about your company just a little bit. So, we talked about located right there across from the YMCA. New facility. Is it open yet?
It's close. We're not in yet, but we're getting there.
It's gone up quick.
Mm-hmm. It has.
And you've been with them how long?
I have been with Fresenius for about 1.5 years.
Very good.
Doing the education.
And you travel through Orangeburg. You travel through Lee County, the whole 9 yards. Team, this is interesting because this hits on. I've gotten a very good education today. I'd have to say you and Dr. Marr have talked over my head a little bit on some of the terminologies, but I will say, being in the medical field for 15 years, I've known only the dialysis centers where we have to go in, and I've heard of home dialysis, but where you go in and you just feel drained and it's Monday, Wednesday, Friday. I think the fact that you're saying, hey, we can travel, we can send you the meds, that's something I don't think a lot of people know.
Sure. We have a dietitian that works for Fresenius that is a peritoneal dialysis patient. She works every day.
Really?
Mm-hmm. So, and if you don't want somebody to know that you are doing dialysis at home, nobody has to know unless you tell them. I mean, you have a catheter, you look and feel just like,
well, there's people with catheters we know that unfortunately have our cancer patients that they can't swallow food and such. Well, very good. Well, as we wind down this show, and again, I appreciate you coming in on this Saturday morning, give us name, contact point, how do we get a hold of you? We have an email where we can get a hold of you. So take this last time to again, reintroduce yourself and let us know how we can get a hold of you and all of our dialysis needs from an education standpoint.
Okay, so what I would like to say is that you can't reverse your kidney failure, but you can help your overall health and well-being by taking care of yourself. I hope that the information that you've received has been useful and educational. It is important to learn all that you can. People who educate themselves about their medical conditions and treatments and take an active role in their care do better than those that don't. If you want more information or if you'd like to attend one of my treatment options class, I'd love to have you. You can reach me at Tina, Silvester, Silvester, at fmc-na.com, or you can call me at the clinic at 803-905-4267.
Tina, fantastic job. Thank you for coming, and we'll be signing off, and we'll all see you next week. All right? Thank you on Medical Forum.